Hi guys, welcome to another live. Monday through Fridays at 4 p.m. I'll be right here to answer any of your questions, to help you to end any pain of your body by fixing your posture. By know your body type, your type of posture, your posture misalignments, we can fix basically almost any pain. But before, you need to understand which posture misalignments you have, and then from there, we can select the right exercise, not only to help you to build muscle and lose fat, but also to end pain and fix your posture. Make sure you will not get any injuries. Luis, how you doing today, Luis?
I'm good. And what about you?
Doing great. Happy Monday. So, Luis, let's get started. What's the first question?
Okay. The first one is how to fix hyperkyphosis.
Okay, let me put this on the screen. Oh, okay, let me put it back. How to fix hyperkyphosis. Hyperkyphosis is the increased curve of your upper back. Start off on the middle of your back and go towards to your neck. When you have hyperkyphosis, your upper spine is bending forward like that. This is we call hyperkyphosis, the increased curve of your thoracic spine. It's very common nowadays because we are constantly bending forward our spine. And because of that, your body adapts to this posture. So when you're using your computer, your phones, when you're typing something, when you're driving, you are constantly putting your body on this position. And if you don't know about this posture misalignment, you might think that this is normal, but it's not. Once you keep your body on this posture for a long time, your body start to change the way that you will do anything on your life. For example, when you start walking, instead of to walk with your spine straight like that, you start to walk with your spine bending forward. When you're working out, when you exercise, instead of to keep your spine aligned, you will keep your body in a bent position, keeping your hyperkyphosis. And when you don't fix that, after a while, you start to develop injuries. For example, on your spines. When you have any misalignment on your spine, your discs, that's supposed to be like that, place like that, you start to put more pressure to one side more than another. You start to create a lot of damage on your spine and hyperkyphosis. Your shoulders will also go forward. So you here, because your spine bends forward, your shoulder blades open and then your shoulders go forward and also your head goes. So because of the problem in your spine, you start to create, developing a lot of the problems on your body. So how to fix that? If your spine is bent, we need to do exercise to extend your spine. Okay? If your spine is to extend, we need to do exercise to help you to bend your spine a little bit. In this case, a little bit bend forward. So I need to work on the exercise that will put my spine in a neutral angle. For example, we need to work on your deep core muscles to start off. What is that? It's kind of the foundation of your house. Think about a house. The deep core muscles is the foundation of your body. Everything starts from there. These muscles help you to maintain and to give support to your spine aligned on a neutral angle. So your spine, there are some certain angles that need to be aligned. When you have any misalignment, you start to change the shape of your spine. And to start off, you need to work on these muscles, your deep core muscles, to help your body to have enough strength to keep your body aligned. So work on some breathing exercise, bracing techniques to help you to expand your breathing capacity and at the same time strengthen your core muscles to have the enough strength to keep your body in a neutral angle. We need to stretch some muscles that are very encurtated, very short. So if your body is like that, you have the chest muscles very encurtated. We need to work on some stretch to your pec, to your chest. And also, we need to strengthen a lot your glutes because your glutes are not doing the job as well. That's why you ended up having a lot of low back as well, because your whole body is connected. So when you have any posture misaligned, you see your body as a one big picture, not only the specific misalignment that you have. But it's not a easy thing to tell you like some specific exercise that you're gonna do now that will help you to fix your posture. But what you need to know, you need to first learn how to stretch these muscles that are very tensing up your spine, make you be on this bend position, and stretch the others that will keep your body on a neutral angle.
Felipe, is it true that uh, we have a certain limit to where we can not treat our hyperkyphosis? Because my wife went to doctor many times, and many doctors told her that her kyphosis or hyperkyphosis, I don't know actually, but it was no longer possible to fix, you know. And after that she even stopped looking for treatment, you know. She just went with her life. And I fear that maybe we can fix it, and then the doctors just told her that we cannot.
There are two types of. There is a one that you acquire there, for example, because of some things that we just mentioned here, the way that you keep your body throughout your day, some muscles that are weak on your body, or the ones that are short, and then you start to acquire this posture misalignment, the hyperkyphosis. This kyphosis is the normal curve of your spine. The hyper is when you have this curve increased. So the case that you don't have any treatment for that is because you already were born like that. It's a bone formation. It's different. Now your muscles weak, and now the muscles they are short. So, but even though for this case, the treatment, the exercise, the type of workout will be the same for someone that have it because acquired. So you need to keep strengthening some muscles around, surround the spine to make sure it will not give you any injury and will be just like that because you already were born like that. In this case, if it's her case, it's different. You just need to work surround the areas, give a lot of strength in your deep core muscles to maintain, to protect your spine, to make sure that this misalignment that cannot be fixed do not go to the next level, give you injuries.
Hmm. Okay. The next one is, what is disc herniation?
And for here, okay, what is disc herniation? We have this gel between the discs, and inside the gel, we have a liquid, okay? When we're using our spine, we're walking, doing anything in life, this gel helps to absorb the impact. But on our lumbar part of the spine, we use that part too much. When you are bending, sitting, doing anything in life that you do this movement, bending your spine forward, you are doing this, bending this part of your discs. And after a while, if you overuse that and don't have muscles around your spine to balance these strengths, you will overuse this gel, and the liquid that you have inside the gel will be leaked out. This right here. This liquid leaking out right here, that's what we call disc herniation, because you overuse that and your body couldn't support anymore, and then one day it will leak out here. It's very common on the lumbar part of the spine because you are constantly using. And if you work out, lift weights on the wrong way, you start to put a lot of pressure, and now with, like, let's say for example a barbell on the top of your spine doing squats, and then this process will be even faster. Or when you're doing any other exercise that you don't know how to stabilize your spine on a neutral angle. What is that neutral angle? When your spine is like that. When you lose this angle right here, you like bending your spine and exercise doing strength with your spine bend, you start to overuse this gel, and then one day it will not support the load anymore, and then it will leak out this right here, this leak that have inside. This is the disc herniation.
And as you said on previous lives, when we correct our posture, the liquid will be reabsorbed, and then you fix the problem, right?
Yes, that's nice because once, let's say, you got the disc herniation, right? So this is the disc herniation right here. Can you guys see? I think so, right? Yes. So this is the disc herniation. Once you align your discs, okay, your body will little by little start to reabsorb the leak that was leaked out here. So once you realign your spine, okay, create muscles around this area over here. After a few months, your body has a highly chance to reabsorb the liquid and then you cure from your disc herniation. So
Hmm. And is it the liquid will be reconstructed based on hydration, or, for example, dieting? Because I figure that the body will not reconstruct it out of nowhere, right?
yes, so everything works together, Luis. Like you're exercising correctly, and you align your spine, creating muscles surround your spine, and also you need the right nutrients to recover from that, because this is like an injury on your body. And your body to recover from this injury, it needs nutrients. So it's very important the nutrition too, and then you can accelerate the recovery because you can do, like say, the right exercise, but you don't eat properly. You're gonna make this process harder, or your body will take longer to recover.
Mm-hmm. Okay, thanks. And the next one is, sorry, how to work out with this herniation?
Okay, I'll put it on the screen. How to work out with disc herniation. Okay, so if you have a disc herniation, you need to avoid exercise that will put pressure on the top of your spine. Let me put back us here on the screen. So let's say you got a disc herniation here. Let's avoid first exercise that you're gonna put the bar on the top of your spine because your spine is not even, okay? It's uneven. If you put a bar here, you'll probably get even worse. You need to avoid those exercises. You need to avoid exercise that will put a lot of pressure toward to your spine. For example, leg press, Romanian deadlift. These exercises are great, but not when the person has a just find out that has a disc herniation. After a while, after we realign the spine and the person knows how to keep the spine on a neutral angle, those exercises are great to build the muscles around the spine to help you to recover from the disc herniation. But let's say when you first start on the first months, you need to strengthen a lot your deep core muscles, the foundation of your body. And then from there, once you learn, and then you have strength on your spine to keep it on a neutral angle when you do this other exercise. And then you're good. Doing then will actually help you to build more muscles on this area, and then you can work out normally, and then you can like cure from your disc herniation. So having disc herniation will not prevent you to do this exercise if you do the preparation first. Usually up to 6 months we can do that working out correctly, doing the postural workout along with the strength workout. So the posture workout and the strength workout gotta be uh, combined, because if you do only posture workout correctly and then when you hit the gym you do random exercise, you're gonna mess up your spine. You can't. You gotta combine both, and then you can work out normal with disc herniation. Then you can even get a cure from your disc herniation.
uh, uh, Everything is connected, right? You have to work out, you have to do the posture exercise correctly, you have to eat correctly, you have to sleep correctly. So, to be honest, being a person that is not on the gym currently, when I look from outside, I find that this is a lot of work. Really have to work and study and then be in contact with this every day. But I also seen that every people that starts and then starts seeing results, they just don't want to get back. The people get addicted to working out.
Yes.
So you just have to start and then persevere for a little, and then things may be fine, you know.
Yes. I was talking a bit before that we start with one client, and she she's really overweight, and on the top of that, she has hyperlordosis, hyperkyphosis, head and shoulder forward, knock knees, genovalgal knees, a bunch of postural misalignments. You guys don't need to know exactly what is that, but it's a lot of postural misalignments. And then she told me, but when I lose weight, this problem will get fixed, right? So I need to lose weight. I told her not. Skin people have the same postural misalignments that you have right now, and then you can get in trouble, get injured. Of course, being overweight will increase the problems of your postural misalignments, will make them worse. But doesn't necessarily because you are overweight is the cause of your postural misalignments, because skin people have them too. So when people start to training, they really worry about losing fat, and that's fine. I understand. But if you don't know this other side of your body, which is crucial to help you to lose fat and build muscle on a safe way to prevent injuries. Let's say, for instance, you start to training, you're overweight, you start doing a lot of crazy things, a lot of exercise, high intensity, this, and suddenly you start to feel some low back pain, and then when you less expect, you have a disc herniation, and then you got to stop. Now you're overweight, now you got a disc herniation, or you got a shoulder impingement, or you got a injury on the side part of your knees, and so on. The list goes on. The approach to lose fat, to build muscle, doesn't matter your primary goal on your head. It's work together with fixing your posture. So I know your type of posture, and then you're gonna lose fat, but at the same time you need to fix your posture. Otherwise, if one day you're losing fat, you're gonna have to swap because you got an injury. So both things are connected; they happen at the same time.
Just like a car, you know. You keep finding problems with your car, and then you just have to fix everything. Otherwise, what you just fixed and then spend a lot of money on it will just be in vain, you know.
Exactly. Yes. Uh huh.
Okay. The next one is, why are painkillers bad for relieving pain?
Why are painkillers? Why are painkillers bad for relieving pain? The painkillers will mask your root cause. I got a low back pain due it to a anterior pelvic tilt. It's just a postural misalignment when you have the increased curve of your lumbar spine. And I start taking these painkillers when the pain gets really bad. I don't know about my postural misalignment. I'm just taking these painkillers. And I'm feeling good. I'm not feeling pain. And then just keep doing what you're doing. Just getting worsening your postural misalignments, but you're not feeling because you're taking medicines. And one day when you realize, when you go to the doctor, you got a big injury on the area. It can be tear your rotator cuff, a disc herniation, nerve pinch, a bunch of things can happen to you, and then you couldn't figure it out before because of the painkillers. Listen, the painkillers are a smart sign on your brain to tell you that something's wrong. It's like God telling, look, you felt that pain here. If you keep doing that, this thing will become something bigger. But when you don't stop and figure out what's the cause of the root cause of this pain, and then take painkillers, it's just masking cover that, and life goes on. Maybe 1, 2, 3, 4 years goes by, and then when you figure out, it's too late. That's why if you have any pain in your body, stop. Okay, don't take any painkillers. You gotta look for someone to do a past evaluation on you. Not even a doctor can help doing that because they don't understand that. You can go to a doctor right now and tell them, can you do a past evaluation on me? It's like you're speaking Greek with them because they didn't study that on the college. And that's okay. So there are a bunch of things that I didn't study, but when someone asks me, instead of to tell them that this doesn't work, I just say, look, I don't understand about it. But sometimes the doctors, they don't understand about that, and they say, oh, that's like, there's no sense, okay? So you gotta just take this medicine and then you're fine. So any pain on your body is a sign of partial misalignment that you have. Unless you just hit something very hard, you fell, but unless that, you have a partial misalignment on your body that's creating this irritation, this inflammation on your body. And then from there, when you know which one is yours, we work from there and then we fix the root cause. I have one client, Sandra. She was feeling pain on the shoulder. She had a shoulder impingement. She went to the doctor, and the doctor said, "Okay, I'm going to give her a cortisone shot." And then she told me, I said, "No, don't worry, I'll take care of that. You don't need to take the cortisone shot." The problem here is because your shoulder blade is out of place. What is that? Shoulder blade is the bone that we have on our back here. When this bone is more opening, toward to our shoulder, the shoulder goes out of place, and then your joint right here, that something they call tendon, and then another thing they call bursa that goes under the tendon. Because your shoulder is out of place, when you move your arm, your bone start touching on this tendon. And then you start irritating that, creating this inflammation, irritation, and then you start to create this shoulder impingement and so on. So if you take the cortisone shot, you're gonna feel great, but you will not fix the root cause of that. And then you keep living your life the way there's everything okay. You keep hurting your shoulder, and then one day you can literally tear your rotator cuff. And then what the doctor gonna say? Oh, now we gotta do a surgery, and then it goes from there. So it's a cycle. If you have a pain, just stop. Let's figure out what's the root cause of your pain. Knee pain. Okay, why? Why you have knee pain? Most likely because you have your knee going toward to each other. We call that valgal knee. So you need to correct that instead of to get a knee braces to work out or take any medication.
And another thing that it's cool to add, it's the tolerance. You know, your tolerance levels are constantly getting higher, and then you have to take more painkillers, and then take another medicine. And it's just like, for example, antidepressants. When you go to a doctor that is trying to heal your psychological issues,
Mhm.
they don't give you the medicine and then you just have to take them for the rest of your life. You know, you have therapy and treatments that you have to follow, otherwise you're gonna spend your whole life taking medicine, and this keeps getting stronger, you know, for them to have an effect. And then that's it, you're not fixing the cause, you know,
The root
just
cause.
walking backwards. It's even worse than if you just don't take the medicine at all, you know.
Of course, and then sometimes you might need a medication, but let's say you already got a real irritation, inflammation on some part of your body. Okay, so went to the doc. Okay, so while you taking the medication, you should be correcting the root cause because sometimes it's really bad. Let's say the people can't really work. So in this case, okay, take the medication because we need to bring down the inflammation. That's fine then. Okay, but while you're doing that, we are here fixing the root cause. That's okay. Okay, you talk about the depression, the therapy they do, they constantly increasing doses, and sometimes they don't treat the root cause because unfortunately the system wants a client for the entire life. What is that? When you take one medication now, I want to go to another medication stronger than that. And then from there, if we keep you as a client, we don't want you to die. And then you're going to be a long term profitable client. Like, can you imagine if the doctor tell you, okay, so you're going to do exercise, you're gonna do diet, and then you're gonna start to treat the root cause of your depression or of your pain or whatever, and then you cured after months without continuously medications, without surgeries, therapies, and so on. So the system don't want that because it's like billion of dollars to sponsor the university, the searches that they do about medication, search, and out of that. So fixing the root cause, it's much cheaper, it's easier, but no few people will tell you that, will explain that. But the system, the insurance, it's all about money. It's not about health. It's a money business. Of course, there are great doctors that work on insurance, definitely. No, we just talking about the majority because it's how the system works. And the good doctors, they might as well open their own thing instead of to work for insurance because they feel disappointed because they have to give the medications. They got like free samples. They have to give that. It's out of their hands sometimes. And most of the times, the good ones say, no, I don't want to this shit, you know? I mean, out of that, I'm going to do my own thing. And then they will charge you $400, $500, $600 for a consultation, which worth, okay, if you get a good one, and then you can treat the root cause of your problems. But unfortunately, the system is like that. You got a pain, you go to the doctor, give you a painkiller. The pain continues. Sometimes they change the type of painkiller for a stronger one. And then the pain persists there. Next step, okay, let's take a MRI. Oh, okay, so you now right now you need a surgery because you know you tear your rotator cuff, you got a disc herniation. Okay, so now and then you do the surgery, and then you constantly using the insurance, the health system.
Hmm. Okay, the next one is sorry. Can strength training worsen pain?
Can strength training worse pain? Yes, it can, but it shouldn't. Supposedly, the strength training fix your pain. That's the goal actually of the strength training.
Mhm.
But if you do a posture evaluation first to see which strength train, which exercise you can do, and then from there we can fix your pain because working out actually is supposed to help you to end any pain in your body because we take the muscles that are weak and then we work them to make them stronger. The muscles that are tight, we stretch them to make more flexible. So by doing this, we put your body on a balanced posture. And then from there, you relieve from almost all the pains possible on your body by only aligning your posture. But 99% of the case, the strength training worsen the pain. Why? Because you're doing random stuff. You hit in the gym, you see a bunch of the machines, and then you just do whatever. And one exercise is good for me, it's bad for you, and vice versa. According to your body type, your postures, just look around. Like everyone is different. How can we do the same type of workout of someone else? And then the most famous apps, influencers, and trainers, you know what they do, Luis? They have an app and then they just ask you most of the times about your weight, your age, your body fat percentage, and then what's your goals. So this is the list. Why? Let's say you got like a bad scoliosis. Your spine is like an S. And then these guys just ask you this information. They don't know about that. And then boom, you got your workout, deadlift, barbell squat. You're gonna mess up your body, okay? Why? Because they didn't analyze your posture. They didn't build the right strength on your body, didn't align your spine, your disc prior doing such exercise. That's why it's very dangerous. Prior to any exercise, we do a posture evaluation to see from there which exercise you will be able to do to fix your misalignments and end your pain, not worsen your pain.
Does my audio is working
Yes.
correctly?
Mm-hmm.
Okay, I had to change the my headphone because the other one battery just died. So just checking out.
Mm-hmm.
And the next question is, how does poor posture contribute to neck pain and how it can be corrected?
Put this here. How does poor posture contribute to neck pain and how can it be corrected? So during the day, we constantly putting our head forward. That's why we got a lot of neck pain because the muscles here on your neck, they need to work a lot to keep to hold your head. When your head is here, these muscles don't work much because your head is aligned to your body. But once you take your head out of the alignment of your body, these muscles create a lot of tension to hold your head. They work a lot. So by having these muscles working throughout your whole day, you create a lot of tension on this area. That's why a lot of people have neck pain. It's very common. We see people with tension on the pain trigger points because the muscles are constantly work, like no rest throughout the day, constantly holding your head. Okay, when you have your head here, we need to work on exercise to bring your head back and also your shoulder, because your shoulders ended up following the movement of your head. So you're not going to have a person on with the head like that. You're going to have someone with the head along to shoulders. So we need to do exercise to bring your shoulders back and your head. About your shoulders right here, we need to work the middle of your back. We call rhomboids and trapezius medius, the muscles between your shoulder blades, the bones that we have on our back. When we shrink these muscles over here, we're going to pull the shoulder blades slightly back, open your chest. And to work on the muscles right here on the back of your spine, any exercise that we do strength training, we do this. We bring the head back, lock it, tuck the chin in. By locking your head, when you do any exercise, these muscles already start to work. You create an isometric force on the muscles. Why is that isometric force? Isometric force is a force that you don't have movement. You do and hold. Dynamic force is when you're moving, like you doing this is something dynamic to your muscles. Isometric when you do the strength and then you hold. So you do isometric hold on your neck, tuck your chin in, and then when you're doing any exercise, you're gonna maintain this alignment of your head along to your torso. That's how we fix the neck. The poor posture to get contribute to neck pain is this.
Mm-hmm. And there is any exercise for us to strengthen our jaw? Just a question that came to my mind.
Mm-hmm. Yes, we have some specific exercise that we lay down, and then it's hard to find this at the gym. Some type of belts that we put on the head, and then we do this movement here to strengthen these muscles. So yeah, but we do have, but most of the times we don't focus much here. We focus more on the back, but in some specific case we can do some specific exercise. This one too.
Mm-hmm. Okay. And the next one is, what are the differences between free weights and machine weights in terms of effectiveness?
Mm-hmm. Let me put here. What are the difference between free weights? What are the difference between free weights and machine weights in terms of effectiveness? First, the free weights are the best in terms of effectiveness of muscles activations, but doesn't mean you only need to do free weights. Why? Doing, let's say, a bench press with the bar when you first start is very hard because you need to engage a bunch of muscles on your body. You need to stabilize your shoulder, your spine, a bunch of things. It's easier to start off on a machine, which will sit, and then you're going to only push the machine with your whole body holding by the machine. So it's easy for you to start using the machines, and gradually you add free weights. Because on this case, the bench press, only the bar of the bench press is 45 pounds. So it's a lot of weight already to start. So the machines are great when you are a beginner. It's help you to understand the movements on a more isolated way. What is that? So you just need to worry about one thing. While you do free weights, you got to worry about a bunch of things. And gradually, little by little, you add those movements, the free movements. So that combination of the two are the best, because you not only think about muscles effectiveness, we need to think about the whole picture for someone that just starting out working out.
I saw on the internet last week that the majority of bodybuilders they says that free weights are indispensable or even better than machines for the type of training, you know.
Yes.
So it's all about what your goal and where you are at the moment. I always find that free weights are cooler, you know,
Hmm.
because you can exercise with a big piece of stone.
Yes, yeah.
Of course, you cannot treat a beginner as a professional bodybuilder. You know, otherwise they won't be there for a week. You know.
Exactly. Yeah, the machine helps a lot for the beginners.
Mhm. Okay, and the next one is how can beginners safely start at strength training and at a strength training program?
Okay, let me put this here. How can beginners safely start a strength training program? First, pass evaluation. You're just a beginner starting off. You need to do a pass evaluation. What is that? Pass evaluation to figure out how your body are on this exact moment. Let's say you can have your shoulders going forward, your head. You can have hyperkyphosis or hyperlordosis, genovagonism. You can have a bunch of posture misalignments or that your body is not well aligned. And then you create this posture misalignment on your body, which creates pain on your body and injury. We start from there. Okay, we analyze your posture, and then we create a posture workout plan designed to teach your brain how to align your body and how to strengthen some very specific muscles, very deep muscles, hard to activate them when you first start, along with other exercise. This muscle called deep core muscles, like the foundation of your body. They are very deep, they are hard to engage them properly. So that's why we create a specific posture workout plan. And on the top of that, we create a strength train to build muscles on the right areas to fix your posture. Everyone has posture misalignments when you first start. Everyone, when you start in training, you have posture misalignment. And the worst case are the people that never done a posture misalignment. These people, the posture misalignments are the worst one. They even have already injuries because they train doing random stuff, random workouts. When they suddenly see just herniation, nerve pinching, shoulder impingement, and then the list goes on. So basically, the beginner start from there. Posture evaluation, posture workout, and the strength train specific tailored to your body needs.
Okay. The next question is it a myth that strength training is not effective for weight loss compared to cardio?
Put this here. Is a myth that strength training is not effective for weight loss compared to cardio. Yes, it is a myth. Why? More muscles that you have on your body, more calories your body will burn. So when you do the strength training, your body will build muscle. By having more muscle, your metabolic rate will be increased. Why is that? Your body will consume more calories only to maintain you alive. So when you start to developing a lot of muscles on your body by sitting, sleeping, doing anything on your life, your body will become a power machine of consuming calories. If you only do cardio and you don't develop muscles on your body, certain point, if you overweight, you won't be able to continue keeping losing fat on your body, and then you can even start losing muscles because not doing strength training to maintain the muscles they already have. Not even maintain the muscle you already have, just doing cardio. If you don't have the proper nutrition, you can even start losing muscles by doing a lot of cardio. That's why it's very important for you to do the strength training as your priority. Let's say you only have 45 minutes. Okay, let's do the strength training. And if you have another 20, 30 minutes, we add the cardio workout, which are great too, because have to work out even more harder. Was that rest faster between the sets? You don't work out instead of to be dying for like 1-2 minutes, 30-40 seconds, you recover, and then you're good to go. So, but if your priority is strength training to make your body become a powerful machine to burn fat.
Mm-hmm. Okay. And the last question is, is it true that lifting weights will make you bulky rather than lean?
And put this on the string. Is it true? What do you think, Luis? Is it true that lifting weights will make you bulky harder than lean?
Not actually, because I heard many times that if you work out without the proper approach, for example, technique and dieting, your muscles can atrophy. So I would like to ask you to if this is true. If you lift too much weight without proper nutrition, you're actually not hypertrophying your muscles. You're atrophying them. Is that true?
You atrophy something that you're not using. So if you're not putting tension on your muscles, not using your muscles on your body atrophy the muscles. Where is that? It's like not using, little like stay there, no function brain. Oh, this guy doesn't need this muscle over here, and they even start losing this muscle. And regarding that make you bulk rather than lean when you lift weights, not. It's the opposite. When you work out, let me put this on the screen. The bad volume that you have comes from fat. The bulk that you're talking about comes from this fat. Okay, when you're working out, you train, and then you start to build muscle on your body. Is this? It's firm. Okay, when you touch your body, you feel something soft. It's because of the fat. It's not because the muscle. The muscle is right here under the fat, but you got a lot of fat here that you think that you're working out, you're bulking, your muscle it's becoming bigger, but not because you're not eating properly, you're gaining more fat and your muscle stay behind here. This amount of fat is covering, is giving you the appearance that you have bulky, but it's not because the muscle, okay? The muscle will do opposite. When your muscle start popping up, you're gonna have less volume on your body, you're gonna be more firm, you're gonna have a toned body. And then you will not look bulky. The bulk is because you're eating too much and you have a lot of fat on your body. It's not because you have a lot of muscles.
Mm-hmm. Okay. This was the last one.
Last one. Okay. All right, guys. If you have any other questions, if you're watching this live later, feel free to send me a direct and I'll put your question on our next live, which is tomorrow at 4 p.m. Here I teach you guys how you can end any pain on your body by fixing your posture to get in shape, prevent injuries. Okay, you can get in shape, but if you don't align your body first, you can get in shape, getting a disc herniation, getting a shoulder impingement, you can tear your rotator cuff, you can injure the inside part of your knees, you can get a nerve pinch, and the list goes on. It's not only about getting shape, but it's getting shape without injuries. You gotta be functional. Sometimes the injuries takes too much time to build because your gel right here on your spine, it's very strong and you can use that wrongly for 10, 15 years sometimes. But one day you're gonna pick up pain on the floor and then you won't be able to move anymore because you got a very bad disc herniation and they might have to need a surgery. And then you thought that was the little movement that tricked all of that. Was not. It was because we're constantly using your back wrong for over 10, 15 years. That's why it's very hard, Luis, to explain that for people when they are young, when they just starting off, because they can't feel anything just yet because the body can support some bad stuff that you do for a few years. But after a while, you're going to start to feel it. And then when you feel it, if you've done a lot of things wrong in the past, lifting a lot of weights on the wrong way, when you feel it will be very, very bad. That's why having a posture assessment, posture evaluation to figure out how your body is right now, and then you can address the right exercise to help you to build muscle in some specific areas to prevent these injuries on your body. It's not about only looking good, but it's about to be good. Like it's like the feeling of the medication. Give you a good feeling, you feel good, but you're not good. Like when you train wrong, you might feel good, but you're not good because you damage your tissues, your tendon, your body. Your body got a bunch of stuff. It's not like muscle and fat, okay? Along the muscles, we have things that are called tendons. They're like 1/3 of the size of your muscle. We got a bursa, we got ligaments, we got a bunch of stuff that goes along to your muscles on your joints. Your muscles sometimes can support the right exercise, the wrong exercise, the poor posture for a while. But your ligaments, your tendons, your bursa, and so on, forget about it. Okay? That's why fixing your technique, your form, improving your posture can avoid injuries in the future. Luis, have anything to add?
No, thank you for inviting me and for the content.
Okay, you guys have a great rest of afternoon. God bless you guys. I'll see you guys tomorrow at 4 p.m.